Hello, I'm Andrew King. I'm a professor of sociology at the University of Surrey in Guildford in the UK, and today I'm going to talk about the work that I've been undertaking related to LGBTQ plus people and housing, both the research and the sort of equality work that I've done. I'm really sorry I can't be with you in person, but huge thanks to the organisers for enabling me to at least present this video. So I'm going to talk about a number of projects that I've been involved with over the last 8 years. The three colourful pictures you can see there on the left are the research projects, and the three that you can see grouped together on the right are the impact projects, and I'll talk about them all a little and what we've learned from them. I think it's fair to say that all of them have used some form of mixed methods and also participatory action research, especially for the impact projects. And all of them have involved collaborations with LGBTQ plus community organisations and members, and people in the housing sector as well. The first study that I'm going to talk about is the Safe Housing Study, which we conducted in 2016-17, and it came out of a series of workshops that we'd undertaken called Older LGBT People Minding the Knowledge Gaps. And we were particularly looking at gaps in knowledge around certain topics associated with LGBT ageing. And we found that there'd been very little empirical study of housing and older LGBT people in the UK since 1995. So we undertook this study really to understand what older LGBTQ plus people's experiences, concerns and preferences were, and particularly what sort of housing that they would like to see available to them in the future. So we asked people what home is like at the moment. The vast majority of people who participated in the survey were owner-occupiers. They lived in their own homes, and they generally felt safe in their own homes. But what we found when talking to people about this in focus groups was that this was quite related to the amount of control that they felt they had over their home environment. So trans participants, both in the survey and the focus groups, were particularly concerned about safety in their neighbourhood, and we heard a number of stories around transphobia and transphobic hate crime being of real concern to people. We also asked people about vigilance at home. What was it like when other people came into their home, particularly people who might provide services as people got older, so health professionals, domiciliary care workers, but also people who might do repairs to a home, and also neighbours as well. And we had various levels of concern expressed about those different groups of people. But one of the things that we did find with the focus groups was a concern that if someone became more frail or had poorer health or reduced mobility, it may make them more vulnerable to discrimination as they got older. So there was, as you can see from this quote here, which is an older cisgender lesbian, effectively saying, I can fight my own corner at the moment, but that might not always be the case. We also wanted to find out how people felt about community and social connections. Certainly social isolation was one of the biggest concerns to come out of the focus groups, and in the survey we also asked people about forms of support that they might expect to need as they got older, and whether they thought they could actually get that support. So we talked about things like emotional support, also things like personal care. And what we found was a fifth of the survey respondents didn't feel they got anybody that they could get support from at all. So that sort of feeling of isolation was predominant for a reasonable number of people in the survey. We also asked people in the survey if they felt they belonged to a wider LGBTQ plus community, and again we found that around a fifth didn't feel that they had any connection. So we again drew the conclusion from that is that there might well be, in a much wider population, significant numbers of older LGBTQ plus people who felt isolated, both from LGBTQ plus social networks, but also more broadly. So we also asked people about housing in the future and what sort of housing they would like in the future. As you can see from those figures up there, 58% of survey respondents had concerns about housing in later life, but 72% had not made any plans about that. So there were concerns, but no plans currently made. Concerns were expressed in the focus groups about discrimination in mainstream housing for older people. People talked about the fear of being discriminated against because of their gender identity or sexual orientation in retirement communities and other forms of housing for older people. And when care was included, the majority of people wanted LGBTQ plus specific provision, although trans respondents were also concerned about transphobia in LGBTQ plus settings as well. We knew of a scheme in the Netherlands called the Pink Passkey, which was an equality scheme framework to identify inclusive LGBTQ plus inclusive housing and care. And we wanted to know if people thought that was a good idea to have that in the UK, and 75% of survey respondents thought that was a good idea. In 2019 and 2020, I was a consultant on some community-led research which led to this report, Building Safe Choices. And it was looking at the housing demand of LGBT plus people in London. And again, things like staying connected to existing LGBTQ plus networks were highlighted as being important. People had quite specific preferences about where in London a LGBTQ plus specific retirement community option should be located, with central London being the main choice. And again, similar to the findings of the Safe Housing study, we found that the majority, when care was included in housing, the majority wanted an LGBT plus specific care provider, and only 2% preferred an unaccredited general provider. So just some reflections on this work. I think it's really important that there are a range of housing options for older LGBTQ plus people, both now and in the future. And that range of options might include LGBT specific housing to be made available, or affirming retirement communities to be made available, but it's also got to be affordable as well, and it's got to be open to everyone. In the process of doing that, I think it's really important to share what works and what doesn't, and engage LGBTQ plus communities in that process. And certainly that's been happening in relation to both Tonic Bank House, which is the UK's first LGBT plus affirming retirement community, which is based on the South Bank in London, and in the work that's been taking place in Manchester in relation to an LGBT extra care scheme. One of the things that we did find is that housing precarity amongst older LGBTQ plus people is an issue. People had concerns about where they were going to live. Were they going to have a home later in life? Was it going to be affordable? What happens if relationships change or if networks change? So there were concerns around that. But we also found that homelessness is very under-researched in relation to older LGBTQ plus people. So the second strand of research that I just wanted to talk a little bit about was the research that we've done around people, LGBTQ plus people who live in social housing. So housing provided by a local government authority, a local council, or a housing association charity. So in 2017, we were commissioned by House Proud, which is a network of LGBTQ plus people working in social housing, to undertake a resident-focused study, so very much focused on the experiences of LGBTQ plus residents, and to provide evidence that could be used for making an impact on policy and practice. So we designed a study. Again, it was mixed methods. It used a survey and focus groups and interviews as well, and it came out as this report here, No Place Like Home, in 2018. So like safe housing, we asked some similar questions around things like safety in the neighbourhood and vigilance at home. And again, we found that people felt that they lived in a safe area, but around about a third of survey respondents didn't think it was safe being LGBTQ plus in their neighbourhood, and that figure was 60% for trans respondents to the survey. And again, we asked questions around people coming into the home and who people would feel comfortable or uncomfortable with. So 36% of survey respondents felt uncomfortable with neighbours coming into the home. And for trans respondents to the survey, that was 91%. And also 21% uncomfortable with repairs, persons coming into their home, maybe to fix something that had gone wrong in their home. And 24% felt uncomfortable with their landlord coming into their home as well. And we heard about various sort of home modification practices that people did. So removing things like photos, as you can see from this quote from a cisgender gay man, but also things like flags and DVDs and anything that could be a kind of clue to somebody's gender identity or sexual orientation. We also asked about harassment, and again, in the focus groups and interviews we heard about various experiences of harassment, but in the survey we asked if residents thought that housing providers dealt effectively with it. As you can see, it was a fairly mixed response to that, with about a third thinking that they did, and a third thinking they didn't, and then a third neither agreeing or disagreeing. We also asked about an accreditation scheme of LGBT plus inclusivity and whether people thought that was a good idea. And again, around about 3/4 of survey respondents thought it was. The other thing I think it's really important to emphasise, and this applies to the previous study as well, is both in the focus groups and in the interviews, people emphasise their multiple identities and experiences of inequality, their diversity and intersectionality, and the need for housing providers to understand this and not just view them in relation to their gender identity and or sexual orientation. So after we had undertaken that research, we came together with House Proud again, and a range of different stakeholders, including housing executives, frontline staff, and LGBTQ plus residents, to undertake a series of workshop consultations. And eventually we produced this equality framework called the House Proud Pledge Scheme. When housing organisations sign up to the pledge, they commit to 3 core commitments, which are to show a visible indication that they're committed to LGBTQ plus inclusivity on their websites and various comms, that staff will have training and education around LGBTQ plus lives and experiences, and that LGBTQ plus residents can have an input at the strategic level of the housing organisation. Then there is a sort of another stage called Pledge Plus, whereby housing organisations and their LGBTQ plus residents can create their own goals, their own commitments that they can work through. The pledge scheme launched in May 2019, and the first sign-ups took place in June of that year. We then ran a series of impact projects to look at the impact of the pledge scheme. They were both called Housing with Pride. The first stage, which ran from May 2019 to February 2020, was really to raise awareness in the housing sector about the pledge scheme, to work with those organisations who were putting it into practice and to sort of track progress with that. And we also created an animation video to communicate the findings of the No Place Like Home research. As you can see by that date, that project finished in February 2020, just as the pandemic really sort of led to various lockdowns and everything else. But we were able to get some more funding the following year, and so we started a stage 2 in April 2021, where we made an initial assessment of the pledge scheme and how those initial signatories to it were getting on. We also created an education toolkit for them to use and to share wider good practices. And we also wanted to incorporate more resident voices and concerns and to make that clearer and amplify it within the housing sector, make those voices and concerns, if you like, louder and to have a greater impact. And ultimately, what that project led to was the creation of a new delivery partnership between House Proud and Stonewall Housing, which is the UK's largest LGBTQ plus housing charity, to actually run the pledge scheme and to ensure its sustainability and governance. And that sort of started in around May 2023 and is continuing, and I think there are now about 30 signatories of the pledge scheme at various stages of progress with it. So just some reflections on that work. It's so important that LGBTQ plus residents are involved. They have absolutely been key to the success of the pledge scheme as well as the research. And really they need to be in active and engaged positions when undertaking this kind of work. So in the co-design of projects and in the implementation of the findings and the any kind of policy that emanates from it. It's also really important to collaborate with housing organisations, various housing providers and charities, as well as LGBTQ plus support organisations and charities. And another thing that's been key for us is working with local and central government as well. One thing I would say I've learned from developing the pledge scheme in collaboration with many others is that it takes an awful lot of thought and planning, and that thinking about the sustainability and governance of the scheme is really important, and it's really important to design that in as you go. Um, and the other thing to say is doing this kind of impact work has been really it's been a brilliant thing to do. It's one of the things that I'm most proud of doing in my academic career. But it's challenging and sometimes it can be frustrating. It's definitely a long-term commitment, but ultimately it's incredibly rewarding seeing how research can make an impact in society. Finally, I just wanted to mention another project that's taking place at the University of Surrey, led by my colleague PJ Anand, called Queer in Shelter. And this is an LGBTQ plus led study around what shelter means to LGBTQ plus people, as well as safe spaces and home and homelessness. So if you're interested in that study, please go to the website, or you can scan that QR code. And finally, just to say thank you very much. I'm really sorry I couldn't be with you in person. If you'd like to contact me, there's my email and also my Twitter link as well. And you're welcome to scan that QR code, which takes you to my personal website where you can download various reports and publications. Thank you very much.